Hi everybody, happy Thursday evening. Hopping on here to talk to you about my first and might as well second chemo experiences for treating triple negative breast cancer. First, I kind of want to explain the very little amount that I understand about why they do chemo before surgery with triple negative breast cancer. The idea behind doing the chemo first is for a few reasons. As I understand it, it's to shrink the tumor. Mine is currently a little over 3 centimeters. And also, I believe it's to just kind of make sure it somehow helps with your prognosis after with your reoccurrence in other parts of your body or in your breasts. So that's why they do a lot of chemo and then they do surgery and possibly radiation, depending on whether or not you have a lumpectomy or a mastectomy. So in my last video, I put a note up and a comment. I kept using the phrase lumpectomy when I meant to say that I had a lymph node biopsy. So I am going to go ahead and say that this was all related to the fact that maybe chemo brain, as they say, is starting. It's just, there's so much, to be honest though, there's just so much information thrown at me, and keeping everything straight is really hard, but I was meaning to say lymph node biopsy, not lumpectomy. I haven't had any surgeries yet. It's straight chemo, 16 treatments of chemo first. So if that confused you, I apologize. But yeah, with triple negative breast cancer, they often do the chemo first. And with other kinds of cancers, it's more common, I think, to do the surgery first, followed by chemo if you need it. Kind of depends on your specific situation and type of breast cancer. So the first chemo experience, I kind of want to walk people through that, just for those of you who care about me and following along, and also for anyone who is about to delve on their first chemo treatment. I want to tell you that, give you a heads up that I think I've been very blessed, very lucky with my chemo treatment so far. It is different for everybody. Please, make sure that you are talking to your doctors about this, your oncologist, so they can give you an idea, and don't be afraid if your experience is different from mine. Everybody is different. So for my first one, I opted to have my childhood best friend come with me. She came up from Iowa and she stayed the night with me the night before. I had an early appointment the next morning. She came along with me, and it really helped calm me to know I had someone in the medical profession with me who also is such a really close friend. So shout out to Candy for that. I really appreciate you coming to my first one with me. It was just awesome having you here. And we arrived, I can do a video later of like what you pack and all of that, but we arrived on time, and the first thing they do is they take your blood. So they do pull like maybe 3 vials of blood out. And what they're doing is they're running a test on your like red blood cell count, white blood cell count, your platelets, all of that, to see if your body is within, if your levels are within range to receive treatment that day. Of course, on day one, not having had chemo, I was going to pass, right? Of course, I was going to pass with the test, if you will. And I was able to receive my first treatment. After you've gotten that done, you meet with your oncologist, and the oncologist will go over any questions that have come up since you last spoke with him or her, and then we'll also kind of walk you through again what to expect. You already will have had what they call a teaching or education appointment, probably with one of the oncologist PA nurses or with an RN, where they'll walk you through what to expect with chemotherapy. They spend the time with you. They give you a packet with what to expect with each chemo, side effects, how to treat them, when to call the doctor if something comes up, and all that jazz. So I met with my oncologist, and then we were ready to roll. So they brought me back into the treatment room where I go. There's not private rooms, but it really doesn't bother me. They're kind of angled like angled parking spaces. You can see the person across from you if there is one receiving their treatment, but they do have curtains you can pull closed. And honestly, I think it's a lovely facility. It's a new building. I am not a super private person, so it doesn't really bother me, and I do have that option to close the curtain. The first thing that they do, they get you all hooked up with your port. So I love the port because I really hate having needles in my arms. chemo can be really hard, is really hard on your veins. So they do access your port for your chemo. They start you out with saline, and then they move over to your pre-meds. So these, for me, I had one oral Benadryl, and I had some Pepsid that was through my port, and I had a couple of steroids, and some nausea medication as well. So they chock you full of all these pre-meds, not only to make it easier for you to receive the chemo treatment and have a less chance of having a reaction to the chemo treatment, but also so that you are pretty set for feeling good the day of chemo when you go home and the day after. You don't feel bad during chemo. You don't feel sick. It's really not, it's really nothing. And honestly, it was my experience and has been now. I've had 2 treatments where the day of chemo, I feel great at night. In fact, I've been hyped up. If anything, the most annoying thing is the steroids make me really hyper and full of energy, and I just feel like an Energizer bunny, and I'm starting to kind of come down now. So I think the day of receiving chemo, if you're feeling good, is a good day to be active. If you're able to take a walk, do some cardio or do some weightlifting or something, I think that's a really good day to do it, and will help you kind of calm down in your nervous system or whatever it is that's kind of hyped up from the steroids. The first treatment I had along with the chemo, I also was afraid of, a lot of people react to one of the chemos I was getting for the first time, and that one is called Taxol. People can react by having breathing issues, just having other typical allergic reactions like breaking out in hives, your blood pressure going up, all this other kind of stuff. It's really unpleasant. So to calm my nerves, because I was afraid, I do have anxiety that I take medication for. I was afraid that maybe I was going to have a reaction in my head, if you will. So I opted to take some Valium during my first treatment. So I took that before the Taxol. I took that during my immunotherapy infusion, which is called Keytruda. That's the one I'm going to have every 3 treatments. So I didn't have it today during treatment, but I had it last week during my first one. That takes about 36 minutes to run. So I took a Valium while I was getting the Keytruda, so that when I started the Taxol, I would be relaxed. And it really helped. Thankfully, I had no reaction to a Taxol, but I will tell you, it is kind of creepy because your nurse will come over like with a big air tank, okay, oxygen tank, and set it near you when whoever's first time it is getting Taxol, they get this oxygen tank, this big green one over there, and they're just ready, right? And what happens if you do have a reaction is all the oncology nurses in the area, if able, abandon whatever they're doing, and they come over and they rush over to you. They all assess you put on oxygen, and then your oncologist drops what he or she is doing. They come in and meet with you. It's able to be resolved, and the good news is after maybe about 30 minutes or so, they stop, they wait, and then they do it again, and you're able to take the treatment in most cases. And then the good news is if you find out that medication, you react again and you're just not able to take it, or it happens the next time, there's other treatments. That was one of my biggest fears was, oh my gosh, but I'm doing Keynote 522, which is the new one for triple negative breast cancer, and I need to take these specific chemos. Don't fret if that happens. Your oncologist has a plan B, a plan C, a plan D that they believe in for treating your cancer. So try not to worry if you have a reaction. That was one of my worries. Everything went well. The first day, I took the Taxol, and then I had the carboplatin. Then they flush your port out and they send you home. Since I had the Valium, my friend drove, and we relaxed, and I ended up taking a nap, and I think that was because of the Valium, and then I felt good. The side effects, I felt good Friday as well, so the day of treatment, Thursday and Friday. Saturday, my side effects mostly consisted of fatigue. I was up for maybe 2.5 hours and had to take like a 4.5-hour nap, slept through my alarm. I was so upset about it. I had family visiting and had missed out on so much, but you have to listen to your body. And I knew since I slept through an alarm that I'd set for 2 p.m. that I must have needed it. So I was real tired. My other side effect, I had constipation. Over-the-counter med took care of that just fine. They worry about if you're constipated for 24 to 48 hours, you need to call, but they also really worry more about if you have diarrhea because you don't want to get dehydrated, and they worry about fevers. So if you spike a temp of like 100.8, you need to call. Everything was fine. I had some bone pain, which my oncologist wants me to keep him updated on how that's going. But honestly, guys, it wasn't bad. It was not even something I would throw Tylenol at. I mean, I just dealt with it. And it would just happen in random places like my finger or, my hip bone or whatever. The other weird, I guess I should say, I had a weird side effect, I think was to the steroids. Which happened, I was napping because I had taken Valium, and I think it was during my Taxol carboplatin treatment. I was awakened to like this intense feeling of period cramping, and then it was like running down my right leg. I thought maybe I just had to go to the bathroom, that didn't help. So I got 2 Tylenol and it went away. It's no big deal. So my first week honestly went really well. Saturday and Sunday were the hardest days, just really tired. The tiredness, it kind of reminds me a little bit of if you kind of overdid it on alcohol and the next day you're just kind of blah and unmotivated. That's kind of what it feels like. So I don't drink, so that's like super unfair. But that's what it feels like. And I do know that side effects can worsen, like the fatigue is cumulative. It's going to get more intense. So I know to expect that. And also I haven't had nausea, so I haven't had to use those prescription meds, but other things can happen. So you just have to be patient and kind of see how it goes. But all in all, my first treatment and the week to follow went much better than I thought it would. And I had my second one today, so I'll update you coming up sometime, next week to let you know how that all went. I go back to work tomorrow. My plan is to not work on treatment days. I'm a teacher, but to be in every other day of the week as I can. May sound insane, but I really enjoy being around my colleagues. I really enjoy teaching, and I think that the movement will keep me busy. I'm going to mask to be careful with germs. And I also just know that if it gets to be too much, I do have the support. I'm very blessed to have the support that I can just take a day off here and there. I can take a short-term disability if needed or a long-term. So the plan is to work and try to keep my life as normal as possible. If you're going through this and you decide you're not doing that and you want to stay home, that is totally fine. Nobody judges anybody through this. You have to do what's best for you. So for me now, trying to keep up my normal life is what feels best for me right now. And we'll see how it goes going forward. So that is my update, friends. I'm sure I'm missing something and I'll be like, shoot. But if I am missing something, I'll put it in the comments below. And I will see you guys on here again real soon. Good to see you all. Love you. And thanks again for all your support. Mwah.